Hello, it's Dr. Rhonda Johnson, and today is Tuesday, May 2nd, 2023. Did you know that May is National Mental Health Month? Well, throughout this month, I am going to be addressing topics pertaining to our mental health. But please know that this information is not meant to replace the advice or treatment of your medical doctor. Always consult your doctor for your medical care needs. Now, most of the information that I'm discussing today comes from the website of Mental Health America. That is a wonderful website. Please feel free to go to it and use the interactive tools on the website, particularly the screening tools. But first, some quick facts. 46% of Americans will meet the criteria of a diagnosable mental health condition sometime in their life, and 50 million U.S. adults are currently diagnosed with mental illness, and this represents 20% of the U.S. population. Now, some of the most common mental illnesses are anxiety disorders, substance abuse disorders and addiction, bipolar disorder, depression, PTSD, post-traumatic stress disorder, ADHD, and the list goes on. This is by no means comprehensive. Now, the one take-home message that I'd like to leave today is that early identification and intervention is key, because the sooner you're aware of mental health issues, the sooner you can begin to address it. So what are some of the warning signs and symptoms? Well, they include problems with concentration, memory, or ability to think clearly, changes in your eating habits, such as loss of appetite or overeating, not being able to complete work or school-related tasks, feeling overly worried, feeling sad, empty, hopeless, or worthless, having irritability and restlessness, loss of interest in activities that are normal for individuals and enjoyable, and a withdrawal from things and being disconnected, or feeling like your brain is playing tricks on you, such as you're hearing things or you're seeing things or you're hearing voices that are calling you to do certain things, seeing things that no one else is seeing, and changes in your energy or sleep patterns. Now, children can have all of those, plus they can have nightmares. They can talk about suicide and death. That includes adults as well. And they can have a decline in their school performance and experience a loss of friends. So again, these are some of the warning signs. There may be others, but knowing what these signs are will help you to identify and catch mental illness early so it can be treated. Because sometimes friends and family are the first ones to notice a change, and they can put these individuals on a course of action. Now, one way to see if you may be experiencing symptoms of a mental health condition or someone that you know is to do a screening test. Visit www.mhascreening.org, www.mhascreening.org, to take a screening test. And you can use your screening results to start that conversation with your primary care provider or a trusted friend or pastor or family member or counselor or social worker. Now, know that if you need immediate help, always, if someone is experiencing thoughts or plans of killing or hurting someone, themselves, or another person, call 911. There's also the National Suicide and Crisis Lifeline. You can text 988 or go to www.988lifeline.org. So that's my message today. Again, I'm going to be talking about this throughout the month. Take care, folks, and be well.